The answer is going to be yes, you should get the COVID vaccine. So the overall data supports that pregnancy is associated with increased risk for ICU admission and invasive ventilation and death and severe outcomes. Also, preterm labor is higher, preterm inductions to help improve maternal status is much higher. Well, if you're 5 times more likely to be admitted to the ICU when you're pregnant, that will greatly diminish after the vaccine is given. It's 95% effective in preventing the COVID infection if you get, that's after both doses. And it doesn't matter if it's Pfizer or Moderna, they're pretty much the same. Your risk increases personally as the community spread increases, and vaccination also helps decrease our risk of spreading it to somebody else, especially someone that we love. In terms of breastfeeding, the Society of Fetal Maternal Medicine, the Academy of Breastfeeding Medicine, they report that there's no reason to believe that the vaccine affects the safety of breast milk. Again, there's no live virus, so no risk of infecting the baby with the virus when you breastfeed. The mRNA actually breaks down really fast, and so it doesn't get into the breast milk. Typically, vaccines create antibodies, which are helpful. They get into the breast milk and help the baby, and that's why we give the pertussis vaccine, the whooping cough vaccine, around 28 weeks. So right now, I don't think it's clear that the COVID antibodies are in the breast milk, but that will remain to be seen, but it's not harmful at all. And the ACIP, which is the vaccine group, recommends vaccinating lactating women, so women who are breastfeeding go ahead and get vaccinated, just like women who are not breastfeeding. Given the mechanism of action of the mRNA vaccine and the safety profile of the vaccine in non-pregnant patients, the COVID vaccine is not thought to cause an increased risk of infertility.
Short answer is yes, as long as you're recovered from the COVID. What we are seeing, just so you're aware, is that if you had COVID before, that your body is probably going to have even a stronger response to the vaccination, which isn't necessarily a bad thing. But we do see people having a little bit more of the tiredness and achiness if you've already had COVID. And from the people that I've talked to, it seems like if you had COVID really bad and it puts you down for a week or two, that your reaction to the vaccination is a little bit stronger. If you had it and you were kind of off for 3 days, your reaction may not be much different than anybody else, but it's still highly recommended because we're not sure about the natural immunity and how long it will last when we understand and clearly know that with the vaccine that it's highly inductive of immunity. One of the things about this virus, Dr. Driscoll mentioned it briefly. One of the reasons why we were able to get on top of this so quickly and they were able to make a really super strong vaccination against it was they understood coronavirus. And one of the main things, everybody's seen thousands and thousands of pictures of this thing. That knob and that spike on the outside of it they already knew that was the target for coronaviruses based on years of work before our lovely COVID-19, and that attacking that, some viruses have certain parts of them that make it much easier to vaccinate against. An example of this is measles. Measles vaccination is incredibly effective because there's one particular part of the membrane that really triggers an immune response and really makes measles not infectious. And so the same thing can be said for coronavirus. Unless coronavirus changed so massively that those spikes went away, the vaccine will work. Oh yeah, and all viruses mutate. If you think about the billions and billions of viruses going on, they mutate all the time. And typically, you know, people that are tracking this, this virus is mutated probably weekly since it started at least once. And viral mutations are tiny and usually don't impact the overall severity of the disease. In fact, if you look back at other historical pathogens, often mutations make viruses less severe. If you have any condition that increases your risk of having a problem with any kind of respiratory illness, you should be high on the list to get the vaccine. It's going to be way more likely to be life-saving than to harm you in any possible way. There is really detailed data from both of these phase 3 trials of the vaccinations that we have in place. Clearly, you have more side effects with the second dose, which makes sense because our body, these reactions like our side effects are related to our body's response to the vaccination, meaning that we're developing immunity. And so when you get the second shot, you're more likely to have side effects, and we're seeing that both within our employees, and it was anticipated. We are keeping track of all reactions. We're encouraging the use of the V-Safe. So if you have just mild reactions, like when I had my first shot, I had a sore arm. The second shot, I had, the next day I was very tired, was kind of, by the 2 days after the vaccination, I really essentially had no side effects. So those mild ones we're not specifically keeping track, but certainly any employees that have any concerning reactions, there's to call the employee health department, and they are employee health clinic, and we are keeping track of that. And we're seeing that what we would have expected to see based on the trials.
And I would just add to that, we are required as part of our provider agreement that any severe reactions, that we need to report that up both to the manufacturer and to the FDA. So it is being tracked not only at a local level, but at a national level.
As soon as enough of the 1A is vaccinated, or at least offered the vaccination, is the short. So when will that happen? There is still a bit of a supply issue as far as how rapidly it's coming into the state. And again, some of the calls that we had earlier in the week with the Iowa Department of Public Health, they have a lot of uncertainty as to how, when they're going to get their next shipments and how much they will be, certainly more than a week in advance. So the short answer is I would anticipate, and Dr. Quinn and I agree with this, that within the next few weeks, we'll almost certainly have more vaccine than we can give to 1A people, and it might be 3 or 4 after into that kind of range, but relatively soon. Certainly within the next month, we should be moving to 1B. I wouldn't be surprised if it's sooner than that. The best way I can answer that is from the Pfizer trial, and they say the 95% effectiveness that they quote is at 1 week after the second dose of the vaccine. The vaccine cannot cause the infection. It's a tiny part of the RNA genome. The virus is made of RNA. And so if you think about, there's a string from one side of this to the other side of this room that I'm in, you're talking about a small strand of that string that is the vaccine, a small piece or derived piece from the RNA itself, and there's no way that it could cause the infection. If you just think about infectious disease in general, I can say this is while it is what we would know, I couldn't say it's impossible at all. I think it's very unlikely. But again, we won't know that for sure until probably years. One of the lovely things about this, and I hope everybody, you know, I was talking at the beginning of this that I want us to go back to normal, but normal doesn't include stopping washing our hands. There are amazing things that have impacted illness, and you know, not just COVID. You think about influenza B, you think about common colds. I saw 2 elementary school teacher patients of mine yesterday, and they were telling me how the kids are not sick. You know, hand washing is extraordinarily effective. Staying home when you're sick is extraordinarily effective in preventing all sorts of diseases. And so there are some behaviors that we need to continue to maintain moving forward forever.